fetal alcohol spectrum disorders are disorders that can occur in people who are exposed to alcohol in the womb. And while it is more common than you would probably think, I feel like people don't really talk about it. You may have heard about fetal alcohol syndrome, but that is just a subset of what we call fetal alcohol spectrum disorders. And these are, from the most severe to the less severe, fetal alcohol syndrome, partial fetal alcohol syndrome, severe alcohol-related neurodevelopmental disorder, and neurobehavioral disorder associated with prenatal alcohol exposure. Some people also group alcohol-related birth defects under FASD, and FASD is just a wide range of physical, psychological, and neurological symptoms. Up to 1 in 20 Americans could be affected, and I know that this number sounds pretty high, but consider that 1 in 10 women, like 10% of women, drink during pregnancy worldwide. Not in America, but like worldwide, which is a lot, so the issue is definitely not negligible. So let's take a look at what FASD is and if you can do anything about it. The leading cause of fetal alcohol spectrum disorders, and this will probably not surprise you, is alcohol, and especially its ability to cross placenta and affect the fetus/baby directly. And in this video I will be using the terms fetus and baby pretty interchangeably, but know that alcohol is teratogenic, harmful to the baby, in all 3 trimesters. Although the effects will differ according to the stage of development. And unfortunately, it's not only alcohol that is harming the baby, it's also its metabolites such as acetaldehyde. And adults have this enzyme called alcohol dehydrogenase that helps them metabolize alcohol in the liver, but that is not present in children. So humans are effectively able to metabolize alcohol from about 6 years of age the least. And yes, there is some small activity of this enzyme even in younger children, but it's about 3 to 4% of effectivity of the adult enzyme, so not only are fetuses/babies more susceptible to alcohol, they also cannot get rid of it. And once alcohol reaches the developing nervous system, it can interfere with several processes that are very important for healthy development, such as proliferation, which is the continuous development of cells in tissue formation, differentiation, which is a process in which the stem cell specializes and becomes a specialized, differentiated one, and neuromigration, axonic outgrowth, integration, and tuning of the synaptic network. These processes are crucial for healthy development. Consuming alcohol in the first 3 weeks of the pregnancy poses risk for developing a healthy central nervous system, so the brain and the spinal cord could be affected, as could be the heart. In the 4th week, limbs are being formed, so exposing the fetus to alcohol in this time could affect the proper development of arms, legs, fingers and toes. Eyes and ears are also at risk. In the 6th week, the teeth and palate might be affected, and in the 12th week, cognitive learning and behavioral skills could be disrupted. And as you can see, a lot of damage can happen in the first trimester, and even before the parent knows they're pregnant, alcohol consumption in the first trimester is associated with facial and brain abnormalities. And even in the 2nd and 3rd trimester, the baby is susceptible to alcohol. For example, alcohol might interfere with their vitamins, nutrition, and hormones. In the 2nd trimester, alcohol consumption is associated with increased likelihood of abortion, spontaneous abortion that is, and in the 3rd trimester, alcohol consumption is associated with decreased height, weight, and brain volume. The risk of developing FASD is proportional to alcohol intake of the mother, so the more the mother drinks, the higher the chance the baby will face consequences. And apart from the amount of alcohol, frequency of drinking also matters. Binge drinking a lot during one occasion, poses a serious risk, as the damage is directly tied to blood alcohol levels. And as I said earlier, 1 in 10 women drink during pregnancy, and 20% of those, so not of the total population, but out of the women who drink, 20% of those binge drink. Drinking 6 standard drinks raises the probability of the child having FAS significantly. It can go up to 4.3%. And of course, not every child exposed to alcohol in the womb will develop FASD, but that does not mean that the risk is low enough for it to be worth it. No amount of alcohol is safe for the baby. It is also recommended that women abstain from alcohol during the preconception period, as you want to make sure that the baby is not exposed to alcohol before you know you're pregnant. And I would recommend the men abstain as well, as alcohol can affect your fertility. The chance that the baby will develop FASD is about 15%, and the chance for FAS is about 1.5% in women who drink alcohol during pregnancy. And even though smaller amounts of alcohol might not trigger full FAS, this might not be visible. There could still be neurological damage and behavioral issues. It is estimated that about a third of children of women who struggle with alcohol use disorder suffer from FAS. And unfortunately, even children of women who don't struggle with alcohol could be at risk, as drinking alcohol is pretty prevalent in our society, and it is completely possible that the mother drank alcohol in the first weeks of pregnancy before she even knew she was pregnant. Unfortunately, there is a variety of symptoms associated with FAS, some of which are visible and some are invisible. The severity of these symptoms is highly individual, but generally there is a variety of thinking, learning, and behavioral issues, plus body development issues. And these issues can have negative consequences on the day-to-day life of affected people. The diagnostic criteria look for three major signs, and that is growth deficiency or selective growth deficiency, for example, small head circumference known as microcephaly, congenital malformation of lips, and nervous system damage that does not have to be visible. The head and face area seem to be affected more than other parts of the body, and eyes and ears are especially at risk. FAS can cause hearing loss, visual impairment including blindness, and the features might be small eyes, thin upper lip, or flat nose bridge. And if you want to hear the proper medical terms, it's short palpebral fissures, thin vermilion border, and a smooth philtrum. And as I said, growth can be affected, and lack of growth is one of the main diagnostic criteria for FAS, and the children are smaller than their peers both at birth and later in life. Inner organs could be also affected, be it smaller brain size or changes in heart, kidneys, or even bones. FAS also affects the mind and is connected to behavioral issues, problems with language development, and even developmental delays or mental deficiencies. This means that the children could reach certain milestones later in life, for example walking or talking, and affected people could also struggle with coordination and balance. Some of these symptoms might mask as other disorders and cause incorrect diagnosis such as poor attention span, hyperactiveness, poor judgment, problems with memory or time blindness, and some people affected by FAS also struggle with improper sexual behavior. And as you can imagine, lacking in these areas might also cause further issues in life, as society has a pretty strict idea of what a child should or should not do. That means that the affected people could struggle in school, they could struggle with finding friends among their peers, and managing various day-to-day tasks. They might be also vulnerable to manipulation and could be at risk of being taken advantage of. The less severe forms of FASD can be pretty hard to spot as there are no visible impairments, and that means that the child could be misdiagnosed, for example, with ADHD or other mental health disorder, and this could cause pretty serious problems as the people might not receive the proper accommodations and receive some other accommodations that might not be as good for them. And on the other side of the spectrum, there are alcohol-related birth defects, which describe alcohol-related defects connected to prenatal alcohol exposure, but with no neurodevelopmental impairment. Diagnosing FASD can be pretty difficult, as only FAS, the most severe form, is officially recognized everywhere in the world, and the other less severe variants are not recognized everywhere. And in a way this makes sense because only FAS and partial FAS cause visible changes to the face structure and the body, and can be diagnosed without confirmed prenatal exposure to alcohol. And as you can probably imagine, a lot of women, for obvious reasons such as fear, will not disclose alcohol consumption in pregnancy. And since alcohol is also so normalized, I feel like a lot of people just don't think much of it. And although there are multiple diagnostic systems for FAS, all of them evaluate growth, facial features, central nervous system, and alcohol exposure. The main difference between these systems is how they treat people who do not tick all of the criteria. As I said earlier, only FAS and partial FAS affect features, and the other levels of FASD do not. And most people will not have FAS, even if exposed to alcohol in the womb. Unfortunately, FASD is not something we can cure. The damage done to the CNS is permanent, and right now, we can do very little about CNS damage. It is still possible to make the lives of people who are affected better through medication, behavioral interventions, and accommodations. It is very difficult to diagnose FASD, especially if you cannot present the doctor with accurate information about the pregnancy, which might have happened years ago. And if the person seeks out professional help later in life, they might not even know much about their mother's pregnancy. Still, the doctor could try alleviating the symptoms with antidepressants, stimulants, neuroleptics, or anxiolytics. And we don't really have any medication that would target FASD specifically. So what are the other options? It is completely possible to affect the outcome of FASD with various behavioral interventions, and the earlier in life these start, the better. It is mostly a variety of different therapies which can help affected children develop important life skills such as social skills, learning skills, and behavioral skills, helping the children face the demands of the world around them and participate in society. Ideally, you want the treatment to be as tailored to the individual as possible, as FASD affects everyone differently and each child will struggle with different areas of their development. And providing the affected child with a safe and stable environment is key to proper development. In the future, we might have more treatment options. For example, people are experimenting with neural stem treatment, which looks promising, but it's not available as of now. But that's it for today's video. I hope you learned something new and interesting, and if you're interested in drugs and addiction, you can follow my channel. I studied addictology and now I make videos on these topics. And if you have any questions, feel free to ask in the comments. I'll do my best to answer them. Oh, and if you're interested in playing mobile games, you can check out my game Mushroom Match, which I programmed and mostly drew myself, and I'm super proud of it. And even some other people told me it's fun and pretty addictive. And it's available on both Android and iOS. If you're interested, I'll leave a link in the video description. And just know that if you have a Nokia phone, there has been some issues with compatibility, so maybe don't try it if you have a Nokia. But other than that, it works. Thanks for watching, have a great one, bye!